Hi, my name is Kim Gowan, and I would like to thank you for taking the time to view my video on the benefits of fecal immunochemical testing, also known as FIT. So, first we want to talk about why we're looking at FIT today. Colon cancer is the second leading cause of cancer deaths in the United States. In 2010, the CDC reported over 131,000 diagnosed cases of colorectal cancer, and 52,000 people died as a result of this disease. The National Institutes of Health predict that in 2014, over 140,000 new cases of colorectal cancer will be diagnosed, and 50,000 people will die as a result. The good news in this is that the 5-year survival rate for those whose colon cancer is found early and treated appropriately is 90%. So screening can make a big impact in colorectal cancer. In 2012, we had a national screening rate for colorectal cancer of about 65.1%. The Healthy People 2020 target was or is 70.5%. So we still have a little ways to go. Now, the caveat in this is that screening rates are disproportionately low for those with lower education and lower socioeconomic statuses. So that means that those of us in the rural health nursing field can impact screening rates out in rural areas where people might not have the option of colonoscopies. There are several options for screening that are recommended by the Preventative Task Force and gastroenterology associations. The first is a colonoscopy, which is done every 10 years. It looks at the colon from the inside, and providers can remove polyps and cancers during a colonoscopy. They are costly and they are invasive. Flex sigmoidoscopy, also recommended every 5 to 10 years, looks at only the lower colon and nothing can be removed during this screening. CT colonography is recommended every 5 years and it looks at the colon from the outside. And then finally there are fecal-based tests which are recommended annually. There are 3 options for this. The first, fecal DNA test, which has not been perfected yet so is not often utilized. The second is a guaiac-based fecal occult blood test, which is the oldest test, and it is the fecal stool test, which is most often utilized by providers. And then finally there's the FIT test, and the FIT test is what we're going to be talking about today. Now, there are several different kinds of FIT tests. I have 2 here to show you. The first is a card, much like the guaiac card, and you send this home in a kit with the patient. The patient has a bowel movement, uses the wand to collect a small bit of water with the stool, and then rubs it on. Now, this specific test needs 2 stool samples collected with 2 different brushes, and then the card is mailed back to the provider's office where the person in the office uses a test strip, and this is a point of care test, but it does require 2 specimens. Now, this is a different kind of test. It is run at a lab, so the kit is given to the patient. Patient has a bowel movement, removes the wand, it has little ridges here. The patient stabs the bowel movement, gets some specimen on there, closes this up, mails it back to the lab that the provider has told them to mail that to, and then this test is run in the lab and the results are sent back to the provider. So this only requires 1 specimen. So those are 2 types of FIT. Now, there are several reasons why providers would choose FIT over guaiacs. The first is specificity and sensitivity. The FIT test is more accurate at detecting adenomas and colorectal cancer and gives us less false positives than the old guaiac cards. The guaiac cards look for blood from the top of the GI tract to the bottom. They're not very sensitive. The FIT tests have a reagent that does look for blood that comes from the lower GI tract, so it is definitely more sensitive and more specific. Second, patients seem to prefer FIT testing over guaiac cards. There were several studies that show that uptake and return rate of FITs were better than that of the guaiac cards. In addition, the long-term costs of using FIT is less than that of using the Guaiac cards. Now, initially there's a greater cost with the FIT screenings because they cost about $22 a piece, whereas the Guaiac cards only cost about $4 a piece. However, when specificity and sensitivity are taken into account, the overall cost of the FIT test is lower. So there are several reasons that providers would choose the FIT test over the old Guaiac cards. Now, if you are a provider, a rural health worker, a community health worker, there is a pamphlet attached to the email you received with this video clip, and on the back it has resources for you that you can use to further look into FIT and also to look more at the two tests that I have discussed today in hopes that you can make the switch in your office, or you can discuss with a provider or with patients that you're talking with about why they might want to choose a FIT test over a Guaiac test. Thank you very much for taking the time to view this video. Goodbye.